K-State Research and Extension in general, we were brought around because of agriculture and what we have done for the ag industry. And we're looking at culture of health being the next big thing for Extension.
Research shows that those who take good care of themselves and make healthy lifestyle choices are healthier, happier, miss work less, and have lower health care costs. Health is one of K-State Research and Extension's 5 grand challenges. A family and consumer sciences agent in the Walnut Creek District, which serves Lane, Ness, and Rush counties in west central Kansas, is working with local health care and other professionals to create a culture of health. On today's Sound Living, improving the wellness of Kansans. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. Erin Petersilie says that the Culture of Health initiative is just now starting to roll out.
It is a charge from Extension, fairly new sort of thing, but we will see it system-wide throughout the United States. But this is really something that we have rolled out in the past year. And as we work towards a culture of health, we are starting with the family and consumer science agents, probably because we think of that as being the most natural fit. But at the same time, we're really working this system-wide with all of our agents because we know that health affects every single person, and we need to be worried about that health option.
One of the things that you've done that I think is kind of a movement within Extension itself is partnering with others in the community to offer this program.
Let me give you a little history on how this partnership even happened. We are a very small community, and the hospital was struggling with doctors. And we were working to get new doctors in, and then we went through a change and a merger, and the hospital kept coming back to me and going, Erin, is there a way for us to offer programming together? Sure, absolutely. And it was always set on the back burner because we were either dealing with trying to get doctors in or trying to go through a merger. And we had a doctor who said, I want to know what our community partners are. And she listed them off. And she goes, and we have Extension support. And he goes, that's the click. That's what I want right there, is that we will have Extension support to be able to offer programming to people.
So what's your role then? Do you set up the programs and take care of all the planning?
Oh, a little bit of everything, because this is very much in its infancy. We have done 1 month. We've done one program. And what we've done is the hospital and I and the wellness center, we all sat down and we said, what do we want this to look like? We want this to look like a noon program. We want people to be able to come in about 10 after 12, and we want them to be able to leave at about 10 till 1. And we literally set up a whole year's worth of programming. We just worked on it right there. And then who we thought we could get to speak on this, we took it back to our doctors and gave them first dibs of which topics is it that you would like to have. And then we started filling in with other professionals.
You started with diabetes?
We started with diabetes. We don't really know necessarily why that was the first topic, but that was just a topic that was thrown out. And we had a doctor go, that is really important. We're headed into the holidays and people are very scared of how do I cook for a diabetic. So I want to not only come in and offer and tell people what diabetes is, but I want to give them some options of how to cook. And I want to do some glucose checks while I am there, because invariably somebody will check out and be above 200. And I know that I need to see them right away. And sure enough, that happened. Nobody thought they would have any issues, but all those sort of things just fell into place for us.
I think I've often heard people say that when someone in the family has diabetes, the whole family has it.
The whole family has it. And how do we cook? Because we don't want that person left out. When we start thinking about Thanksgiving, we think about food. That is our primary objective when we start talking Thanksgiving. And if we have to start doing those special diets, we want everybody to be able to enjoy that food. And how can we change those recipes? And how can we eat differently during that day so we can still enjoy maybe the way grandma made something, but not completely blow our blood sugars as well?
Well, that kind of ties in with your next topic then, too, is you're going to be cooking healthy for the holidays?
Yes. So then our next topic here in November is cooking healthy for the holidays. And sometimes it's just remembering maybe not quite so much salt and really remembering to try our foods before we add some of those things. But yes, Linda Beach, a fellow extension agent, is going to come in and show us some ways that we can do less caloric intake for the holidays.
Well, something that people often think about is, I need to slim down this recipe, and really almost any recipe can be slimmed down.
And a lot of that comes just from products that are available. 10 years ago, we didn't see Splenda on the market as a very easily accessible thing for us to do. Now we can do that and use that as a sugar substitute and really still get a very good product, because that's something when diabetic cooking came out, it didn't taste well. And now we have options to not only make it good for us, but it can taste well as well.
I think we've also learned over the years that maybe we don't have to make every dish that Mom or Grandma used to make. Maybe we can pare down the menu a little bit too.
Yes, but change is hard, and we always have those favorites. That was our first Thanksgiving. First Thanksgiving without Grandma, we still made something that she made, and all of us turned to each other and said, none of us even like it. We don't even like it. So let's start looking at our menu and what we wanted to have. So sometimes it takes a little changing of the guard as well. But no, we don't need to make everything that they did, and we don't need to do the huge portions as well. A little bit smaller plate, a little bit less can cut out a lot of calories as well.
What are some of the other things that you're going to focus on over the coming months?
We have really taken a holistic approach to this. So in January, we're going to talk stress, and not necessarily just holiday stress, but just stress and how it affects our everyday lives. And maybe it's stress from money. And as we talk about money, we'll do a piece on financial planning that will happen in February. And I know that's something people don't think about, but we need to look at that overall well-being. We also are looking at exercise. We all know that exercise happens and that we need to incorporate it into our daily lives, but maybe we don't know how it needs to change as we grow older. And so we have somebody coming in who's going to talk about that aging process and how we incorporate exercise as we do continue to age.
Is that one of the things you looked at, is the target audience for your 3 counties?
We did. We looked at what are people in need of? What do we have access to right now? We didn't want to pull anything that we didn't think we couldn't get an expert on. And part of it was, what are the doctors seeing in the office? So that when people were thinking health, we want them to think Rush County Hospital. We want them to think K-State Research and Extension, so that we had a broad sort of topics that people were interested in, but at the same time really met the needs of our community as well.
I've always found that it seems like if 1 or 2 people have a question, a lot more people have that same question.
Oh, yes. A lot of people have that question. And the day that we had the diabetes workshop, we had somebody come in and made a comment about, you're having a workshop today, right? Yes. And what's the workshop on this? I know somebody that needs to be there. And she got on the phone right there and made 3 phone calls to friends and family members and made sure that they were at that workshop an hour later.
In terms of working together with the community members, do you set the tone for that? Do you kind of give them some how-tos maybe on the extension model? Because we do kind of have ways that we like to do things.
We have ways that we like to do things. Good question, because right now we are just still feeling the waters out. And as we have promoted some of these programs, we've started to get some feedback of some specific questions that people have out there so that we can hand that to our presenters and say, look, here's a concern that we are seeing. Can you address this topic when you come and talk to us?
That's always nice when you can get the public to kind of take ownership of the series, because I think you'll continue to see more and more people at each session as you touch on the things that are of interest to them.
Yes. If we can get them to buy in, then word of mouth is still our best thing. I can pay for a lot of advertisements in the local newspaper or on the local cable, but when I can get people to talk about it, then the interest and the number of people coming to a program will increase tenfold. We want this to be hands-on for people. We do not want this to be necessarily a lecture style. So expect questions, expect needing to follow up with people as well.
Also, the fact that you're doing this over the lunch hour makes them condense the message, and sometimes people like that too.
Yes. It keeps people from being too carried away. I have one presenter who's very worried about the time frame because he sees a lot of legalese questions going to happen with the estate planning side of things. And I said, that's not a problem. I'll book the room for you for the entire day if that's what needs to happen. But I need the message to be here. And then I need you to give them information of how to contact you to ask more questions. And those that can stay past the lunch hour because maybe they're retired or they're not worried about getting back to the job right away, then those that need that more one-on-one time are welcome to stay and get that.
That's really a great idea, because that does give them the flexibility then to hang around afterwards. Also creates a little bit of socialization within the community.
Yes, creates that socialization. But a lot of times when, like you said earlier, when one person has a question, chances are there's lots of people out there that have the question. Or when it comes to, I'm going to pick on estate planning here just a little bit, I don't know the questions that I need to ask about it. But when I can hear somebody else ask a question and that helps spark some other questions for me, that's a good learning thing that we can feed off of one another.
The nice thing here is we always talk about knowledge for life, and this really fits right in with that, doesn't it? The fact that you're passing this knowledge along to the entire community.
Yes, this is what Extension has been, and that we want to keep informing people so that not only are they informed, but they can make those life changes as well.
When you're wearing your family consumer sciences hat and you're thinking about all these different programs, are you thinking, I'm going to run out of programs?
When we had this first meeting of, well, what do you think we should have for programming? The first thing I did was went to the bookstore and looked to see what we had leaders' guides on and what did we have information on that was already set for easy handouts. Because our doctors don't necessarily think in handout mode. They think in information mode. But if I could come up with something that supported them or gave people more support, this was a great thing. And there will always be new topics. There will always be new challenges that we will see in our communities. And we'll have to grow and change with that as well.
Is this also an opportunity to introduce the people to some of the other programs that you offer throughout the year that may be 8-week programs or 12-week programs?
Absolutely. For a lot of people, this is the first time in our office doors. Maybe they've heard K-State Research and Extension. They didn't really know how it affected them. Or for those that knew what K-State Research and Extension was, but they hadn't necessarily had that connection with our local hospital and wellness center. So hopefully this will bring both worlds together and make us stronger.
And you're doing this at the hospital or where?
We are doing this at the Extension office. So this gets people in our door as well. In all honesty, our hospital or our wellness center really don't have the meeting space for this to happen. So when people walk in our front doors, they get to see all sorts of other things. They're seeing other flyers. They are seeing our agents that are in there. So this has been really good for Extension to be able to be in our own office.
Really seeing how engaged you are community-wide.
Correct. This lets them put all those faces and names together. It gives them the resources. They see the racks as they first come in. And that's probably the first comment that somebody makes is one of the racks catches their eyes and said, oh, well, I have this grass issue or I have this weed issue or cooking issue, whatever it is. And they grab something there because they didn't know they could get the resource.
And you are starting in Rush and may expand?
Okay, so we've started this in Rush because that was where the need was. That's where we had the resources to go. We have been asked to expand this, and part of this is very much in the conversation side of things, has been to expand this over into Ness County as being the next county that we expand this into. And it's not that the hospital doesn't want to be involved, but it's really the library that is driving this in Ness County, in part because libraries need to have adult programming, and they need to have so much adult programming for accreditation, which was a new thing that I learned at lunch the other day. And part of the other reason that they want to do this is they have a lot of state employees in that county, and we all know that those points are very important for those that are on that health insurance plan. And we have gotten the approval that every one of these programs is for a Health Quest credit. So this has really helped drive attendance as well.
I know you're starting with culture of health. Is there a possibility somewhere down the line we may see the culture of horticulture or culture of agriculture? Is this something that you're going to make the other agents take part in?
Well, sure, we can do that. And we have incorporated our other agents into the culture of health. So I have brought my agronomy agent in and will be doing one of the programs on gardening, because we know that when we can get people to eat locally, eat that fresh vegetables, they're more likely to eat it. Gardening's a workout. So don't discount it as one of your activity levels as well. So yes, we have brought some of that in. K-State Research and Extension in general, we were brought around because of agriculture and what we have done for the ag industry. And we're looking at culture of health being the next big thing for Extension. I think there's a lot of great models across the state of Kansas of people that are working towards the culture of health, but I think it looks very different in any of our communities. And you really have to assess the needs of your community. What resources do you have? What needs do you have? We've talked a lot today about the opioid crisis. It's hitting Kansas. We know it's a very serious issue, but there are probably pockets in Kansas that's a more serious issue. So I look at them probably doing more education around that.
That's probably the biggest asset for Extension is the fact that the agents are able to target things to their communities.
Yes. This is going to be a local thing. And when we can address the needs in our community, it's going to be also what makes us very successful.
If somebody is in or around your area, how can they find out more about this program?
Facebook, our Walnut Creek Extension Facebook page, the local media, all those sort of things. If you're on our newsletter mailing list, will work as well. We have also reached out to local agencies such as the NRCS, the Conservation Office, to have them mail out about these programs so that it gets in the hands of more people. But we also know that a lot of those farmers maybe need the points as well, but this is a lot of very important information for their clientele as well.
That's K-State Research and Extension Family and Consumer Sciences Agent for the Walnut Creek District, Erin Petersilie. K-State Research and Extension offers a variety of wellness programs such as Walk Kansas, Dining with Diabetes, and Stay Healthy, Stay Strong that educate, support, and motivate Kansans to make healthy lifestyle choices. More information about Extension wellness programs is available at county and district extension offices and on the Extension website, www.ksre.ksu.edu. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.